Good day, everyone, and welcome to another session of Business World Insights in partnership with Hope from Within entitled Cancer Game Plans 2.0 or CGP 2.0, Putting the Game Plan into Action. My name is Charlene Chua, Business World Senior Reporter, and I will be your host and moderator for today's discussion on how we can effectively win and combat the fight against cancer together. Last month, Business World Insights and Hope from Within was all about winning the breast cancer fight, from prevention, early detection, and support. And we've tackled important topics such as empowering patients, families, friends, and support groups, thereby breaking the breast cancer stigma and more. But for today's session, we will extend the discussion by involving key drivers in the Cancer Game Plan 2.0, the public and private sectors. With the Universal Healthcare or the UHC and the National Integrated Cancer Control Acts or NICA in place, we're one step ahead of the game plan, but how can we ensure its sustainability? And to talk to us more about those topics, we have today a distinguished panel of speakers. Joining us today are Dr. Buenaventura Ramos Jr., President of the Philippine Society of Medical Oncology or PSMO, and Ivan Arota of Ayala Health. They will also be joined by our Hope from Within ambassadors, Tirsa Cruz III, Ariela Arida, Marlo Mortel, and Nina Corpus, all of whom we will meet later. And so to kick off the session, let's welcome our first batch of speakers. Hope from Within Cancer Game Plan Report Philippines Ambassador Nina Corpus and Dr. Buenaventura Ramos Jr., the President of the Philippine Society of Medical Oncology. Hello, Nina and Dr. Bill. Thank you for joining us today. And please say hi to our audiences.
Hi, Charlene. Hi, Dr. Bill. It's great to be here.
Hi, Charlene. Hi, Nina. Hello, everyone. Thank you for having me.
Yes. Thank you so much. We're glad to have both of you here with us today. And now, without further ado, I'd like to address the first question to Dr. Bill. Cancer, as we know, is the second most common cause of death globally, accounting for about 9.6 million deaths in 2018. Can you briefly give us a picture of what you're working with and the current burden of this disease in the Philippines?
Thank you, Charlene. According to Global Cancer Observatory, the disease continues to be one of the leading causes of death worldwide. In 2018, it was reported that over 9.6 million people died from cancer. Locally, over 140,000 Filipinos were diagnosed with cancer in 2018, with around 86,000 deaths recorded. These are alarming numbers. This means that around 200 or more people are dying daily because of cancer. What's more, the limited resources, poverty rate, the pronounced inequity in terms of access to cancer care services, and overwhelming out-of-pocket expenses also continues to increase the burden of affected patients and their families.
Okay. Thank you, Dr. Bill. Those numbers are very, very alarming. But I understand that several organizations, including the Cancer Coalition Philippines and the Philippine Alliance of Patient Organizations, and of course, Hope from Within, have collaborated and launched the Cancer Game Plan PH to address and eliminate the burden brought by cancer that you mentioned. And now we're going to Ms. Nina Corpus, the new ambassador of the Cancer Game Plan PH report, who is also dubbed as Hope from Within's Tita Hope. So Tita Hope, can you please give us a bigger picture of what Cancer Game Plan Philippines is and what does it aim to achieve in terms of patient access in the continuum of care for cancer?
Hi, Charlene. I'm glad to be Tita Hope for everyone. So let's talk about the Cancer Game Plan or CGP. It is a multi-stakeholder advocacy that aims to raise awareness towards initiatives that can help strengthen cancer prevention and control in the Philippines. CGP believes that initiatives should have patients at the center, particularly regarding access to cancer care and control, to be able to make an impact. A strong and involved patient voice, along with public and private stakeholders that are willing to listen and really put this into action. We need this voice to shape the development of cancer programs, as well as to strengthen and empower the LGUs to contribute in the process that can make the implementation more efficient, faster, and beneficial to all stakeholders in the health system. So we hope to have a louder and broader voice. Because if you may not know anyone right now, you never know, di ba, baka bukas, next week, next month. And lending your voice, we have nothing to lose. But when cancer comes to you or your loved ones, wag naman sana, no? But you have everything to gain. The CGP basically wants action put into the discussions around cancer that we've had for many years now. Charlene.
Okay. So I think the most important thing is we have to amplify and work together to amplify those voices to help our cancer patients. But for us to actually grasp what the cancer game plan is, let's go back to the past and let's go back to 2018. Hope from Within, together with different stakeholders, held the Cancer Game Plan Summit at that time. But can you share with us the key outcomes from this multi stakeholder collaborative dialogue and what were the goals back then, Nina?
Yes, in 2018, the first Cancer Game Plan Summit was held, and the most important topics discussed were access to early screening, diagnosis, treatment, and even palliative care from the perspectives of many different stakeholders like the medical groups and doctors, the patient and caregiver groups, and the government. It was an engagement of individual experience with national policy. So after the summit in 2019, two legislations, the Universal Healthcare Law and the National Integrated Cancer Control Act, or the NICA, were signed. The implementing rules and regulations were also drafted and submitted. It was mentioned at the summit na yun nga, mas malaki ang laban doon when we start to operationalize things. You see, we may write the policies, but the funding and clear-cut guidelines need to come into play too. And so really, multi-stakeholder collaboration is at the heart of successful cancer care in the country. That will help us take the next big step to full implementation of these landmark laws. Kasi sayang naman.
Yeah, sayang. But what exactly is the Cancer Game Plan report? How did this report come about? And what is the significance of this to local healthcare? I think you touched a bit about it kanina, pero can we have a little bit more?
Yes, the CGP report is a health impact projection model. It is a research conducted by medical professionals such as Dr. Madeline Valera. She's a former Undersecretary of Health at the DOH, and medical oncologist Dr. Gerardo Cornelio of St. Luke's Medical Center, along with top representatives from MSD in the Philippines. The research shows how innovative treatment options like immunotherapy allows cancer patients to enjoy added years to their life and added life to their years. This means getting a new lease on life after cancer, living like, normal, na parang natututukan mo pa rin yung business mo, nakakapasyal ka pa rin ng kasamang pamilya mo, and you don't experience the supposedly debilitating effects na lagi nating naririnig. Some patients, I've read and have heard experiences from oncologists themselves, don't even experience hair loss or weakness or loss of appetite. It's just really added life years, progression-free life years, quality-adjusted life years, avoidance of adverse effects, and overall improved health gains between 5 and 10-fold. Can you imagine? Healthier people are more productive people. They can still contribute to our economy rather than being in their sick beds. When they go out in the past, nung kaya pa natin itong pwedeng gawin, di ba? Let's say, watch a movie for free. They still go to the restaurants and eat, buy a cup of coffee, buy donuts. Now, I guess in this new normal, they can still join Zoom Zumba sessions, as in Zoom Zumba. And of course, in your Zoom, di ba, you still need to look good. And they will still buy those exercise clothes and sneakers online. So, these promising results should be turned into an action plan that can benefit every Filipino, especially those in the lower income brackets who still deserve quality healthcare. So legislations like the UHC and the NICA really need to move along and find solutions to provide equitable and sustainable access to these life-saving, innovative treatments to more Filipinos is so important right now, especially during this pandemic.
Yes, I agree. I completely agree. And thank you so much, Nina. And now we're going to have to move you backstage a little bit as we proceed to the next part of today's session, the way forward. Dr. Bill will still be with us for his part. And Nina, again, thank you, and we'll see you later. And now for the next part of our session, to better understand the roles of public-private sectors in this fight, Dr. Bill will be joined by Ivan Arota of Ayala Health. Please say hello to our viewers, especially Ivan.
Good afternoon, everybody. Thanks so much for asking me to join this forum. Hi, Dr. Bill.
Hello, hi Ivan.
Okay. So, Dr. Bill, again, we go back to you. So, just to revisit the healthcare laws, essential healthcare laws, can you give us an overview on what is the status of the NICA?
Okay. The National Integrated Cancer Control Act, or NICA, was actually signed into law last February 14, 2019. That was our Valentine's Day gift. And it shall serve as the framework for all cancer related activities of the government. The program shall have the following objectives. There are 8 of them. Allow me to tell you about them because they're important in our discussions. One, to decrease the overall mortality and impact of all adult and childhood cancers, to lessen the incidence of preventable cancer in adults and children, to prevent recurrence, metastasis, or spread, and secondary cancer among survivors and people living with cancer, to provide timely access to optimal cancer treatment and care for all cancer patients, to make cancer treatment and care more affordable and accessible, to improve the experience of cancer treatment and care of patients and families, to support the recovery and even the reintegration to society of the cancer survivors, and to eliminate various forms of the burden on patients, people living with cancer, survivors, and their families. The IRR, or the implementing rules and regulations, are already created, and done, and actually distributed to the concerned people, concerned agencies, and institutions. Yun, nagawa na siya, na-set na siya, nagawa na yung law, na-set na yung IRR, and distributed to everyone.
Mm-hmm. And I think it's very, very important, especially the points you were talking about, that the IRR and the goals of the NICA. But these laws were signed last year, kaya nga tayo may RRR na, di ba? But how important is that these legislations are not only implemented, but also appropriated, Dr. Bill?
Okay, basing on the overview that I have said regarding NICA, it's very comprehensive and aims to address all aspects of the entire continuum of healthcare services, which include risk assessment, primary prevention, screening, diagnosis, treatment, survivorship, and even end of life care. And the law applies to cancer patients, patients living with cancer, cancer survivors, and as I have mentioned, even their families. NICA defined cancer survivorship as the period starting at the time of diagnosis and continues throughout the rest of the patient's life. Family, carers, and friends are also considered survivors. Survivorship care has 3 distinct phases: living through, living with, and living beyond cancer. Such law referred to cancer treatment as the interventions that are aimed at curing the disease and improving the patient's quality of life. It also includes the establishment of the cancer care infrastructure, the Philippine Cancer Center, and the cancer centers nationwide. Aside from that, it also involves cancer awareness campaigns by health education in schools, workplace, and the community, cancer registry and monitoring system, and a lot of other things. So we come to appropriation. Having said all that, that would require a lot of money. Section 20 of the law actually says, in its IRR in the law, it is about the establishment of Cancer Assistance Fund. Cancer Assistance Fund supports the cancer medicine and treatment for cancer patients. It is under DOH, the Department of Health shall manage the fund under their existing budget. Section 21 of the law says that the PhilHealth, or the Philippine Health Insurance Corporation, shall expand its benefit packages to include primary care, screening, detection, diagnosis, treatment assistance, supportive care, survivorship, follow-up care, rehabilitation, and end-of-life care for all types and stages of cancer in both adults and children. At the moment, PhilHealth just actually funds the Z package of PhilHealth, which is the bigger budget, actually funds only the early stages of breast, prostate, colorectal, leukemia, and for kidney. Not the kidney cancer though. Cancer Assistance Fund and PhilHealth benefits shall be made available in public and even private DOH licensed cancer care centers. Section 22 on social protection mechanisms. The DOH, in collaboration with the Social Security System or SSS, the Government Service Insurance System or GSIS, Philippine Charity Sweepstakes Office or PCSO, DOLE, Civil Service Commission, DSWD, PhilHealth, and LGUs shall develop appropriate and easily accessible social protection mechanisms for cancer patients, persons living with cancer, cancer survivors, and again, their families and carers. So lahat ng yon kailangan mabigyan ng budget.
Yes, I agree, Dr. Bill, and what we can see from your segment is that napaka-comprehensive na Nika. Pero why should everyday Filipinos, just to make it parang layman's terms, like how does Nika affect everyday Filipinos?
Sometimes if it doesn't involve our immediate family, then we may think it won't involve us. But with the statistics that I've mentioned, 140,000 Filipinos in a year, sooner or later, it may come to someone you know. Then it would affect your everyday life. It may come to your family member. Then you would be concerned with the patient's treatment and survival. Then you would be involved with the financial burden. Because unfortunately, cancer treatment can be expensive or can be very expensive. And we would need all the help and support from the government.
Yes. So everyone is affected and everyone is in this fight against cancer together. So the NICA also emphasizes government support, di ba po, for all types and stages of cancers in children and adult patients and their caregivers. Just to reiterate, what treatment options may be subsidized, and in your opinion, what other treatment options can be added to the registry?
Okay, as I have mentioned earlier, the law refers to cancer treatment as the series of interventions that are aimed at curing the disease and improving the patient's quality of life. And this would include psychosocial and nutritional support, surgery, radiotherapy, radioisotope therapy, and drug therapy, which includes chemotherapy, hormone therapy, biotherapeutics, immunotherapy, gene therapy, and supportive therapy. So what can be added? On the article on essential medicines, the DOH shall ensure access to essential medicines for cancer drugs listed in the Philippine National Formulary or PNF. Ito yung list of our medicines that we consider as essential medicines in the design of publicly funded programs. Cancer medicines listed in the PNF or the formulary, and even non-PNF medicines and other health technologies in the process of review or not yet approved by the council may still be accessed through donations, special access schemes in the private sector, and other available means properly coordinated with the DOH, under, of course, the DOH rules and regulations. So these are the points where we can still add to the existing list.
Okay, I think so it just means that there's more room for improvement in the NICA and the registry. And I think I want to point out that you've talked about immunotherapy, diba? And so let's talk about that and the PSMO-led petition campaign. But first, immunotherapy. Can you share with us how it works and what makes this innovative, and how important are these kinds of innovative treatments among cancer patients?
Okay, immunotherapy is a type of cancer treatment that boosts the body's natural defenses to fight cancer. It uses substances made by the body or in a laboratory to improve how our immune system works to find and destroy the cancer cells. So basically, the drugs stimulate the body's immune system to recognize and to kill cancer cells. Compared to commonly known chemotherapy, which involves the killing of the cancer cells, these newer forms of treatment have lesser side effects and more tolerable for most patients. With immunotherapy, we need to reconsider the way we look at cancer treatment outcomes. Now, it would not just be overall survival, but does the treatment also give the quality of life while he or she is alive? This is
Mhm.
measured quality of adjusted life years. This measures the patient's quality of life for each year that they are alive. We can say that we should not keep our patients alive. We should not just keep our patients alive. We should keep them well enough to enjoy life with their family and friends. And immunotherapy may help us achieve those goals.
Okay. So quality of life, even for cancer patients, especially for survivors. But I understand that the Philippine Society for Medical Oncology has started a petition campaign on the approval of the establishment of the National Integrated Cancer Control Council. And Dr. Bill, why should the public support this? And what is the role of such a council in the implementation of NICA?
As an act of solidarity with our cancer patients, the Philippine Society of Medical Oncology started this campaign. It's called Sign the Petition for Cancer Assistance Fund Now. This appeals for the approval of the Department of Health's Cancer Assistance Fund to support the NICA. We posted the petition in our website www.psmo.org.ph. The petition appeals for the establishment of the National Integrated Cancer Control Council, as you have mentioned, which is actually integral to the implementation of the NICA. As we all know, the provisions of the said law have yet to be realized, and the Cancer Control Council will be a crucial early step for it to move forward. The National Integrated Cancer Control Council shall act as the policy-making, planning, and coordinating body on cancer control attached to the Department of Health. The Council shall provide technical guidance and support and oversee the implementation of this act, ensuring the judicious and best use of available resources for the benefit of all, especially the most vulnerable sectors of the society, the elderly, the women, and children, the poor, the marginalized, and disadvantaged. So sila po talaga yung magpapatakbo ng batas na ito.
Mhm.
We also ask for your help in sharing the said petition through social media and to any of your influential friends so that we can gather more signatures. We target 25,000 signatures and we're presently at 18,891. So that's about 6,100 more. Isang mahalagang hakbang para sa mga mahal nating cancer patients ang pagkakalagda ng NICA. Ngayon, panahon na para sabay-sabay nating bantayan ang aktual na implementasyon nito. Ang unang hakbang, ang maipasa ang budget na iuukol para sa mga benepisyong pinapangako ng NICA sa mga cancer patients. Ang petisyong ito ay naglalayong maparinig sa mga kinauukulan ang pagnanais nating maaprubahan ang Cancer Assistance Fund line item sa budget ng DOH. Kaya inuulit ko po, www.psmo.org.ph. Let's sign the petition.
Okay. So again, for those who wants to sign the petition, go to the PSMO website and sign it. We only need a few thousand more, right, Dr. Bill? Thank you for your inputs. And now we've talked about the collaboration between the government and healthcare groups. And now let's hear it from the perspective of the private sector. Hello again, Ivan. And as a representative of Ayala Health, why do you think it's important that the private sector also participates in this advocacy to make quality cancer care accessible to all Filipinos? And what does Ayala Health do in order to make this access equitable and accessible for everyone?
Sure. Thank you again for having me here and join the discussion. I certainly learned a lot from what Dr. Bill just shared. I became a few levels smarter in terms of cancer care because of what Dr. Bill shared today. But yes, the private sector is definitely part of the overall picture in terms of being able to improve the cancer landscape in the Philippines. In fact, it was mentioned earlier that it's a multi-sectoral approach really for us to become successful. Of course, we already heard about the importance of the policymakers, government, to ensure that the NICA implementing rules and regulations are implemented and operationalized. We need, Dr. Bill stressed this, the funding, right, from different groups, from appropriations at the national government level to PhilHealth, right, and PCSO as funders, and even LGUs, for their constituents. Of course, the healthcare professionals, play a key role, like the PSMO, right, who's led by Dr. Bill, who want to make sure that, who are central in making sure that care for the patients are actually done appropriately. And then, of course, why are we doing all of this? Central to everything is the patient, right? Supported by the different advocacy groups like, the Cancer Game Plan, I Can Serve, CareWell, and the other foundations supporting cancer patients. And finally, of course, the private sector. It's again, industry in terms of breakthroughs in the treatment and diagnosis from companies like MSD, and then the groups like us, AC Health, or providers, and trying to find the right solutions and contribute as well to the plight of cancer patients. Maybe as an example, right, I'd like to share some slides, right, of what we're doing in AC Health, right, to help deal with this disease, especially now during the time of this pandemic. Yes, next slide, please. Yeah. So AC Health basically is a wide portfolio of different companies, healthcare companies, being supported by 4 pillars. The very left side is the pharma pillar, where the groups like the Generica drugstore fall under IE Medica, which is a pharma distribution company. And then on the second pillar, we have the clinics, primary care clinics like Family Doc, Healthway, multi-specialty clinics. The third pillar are more of the digital solutions, EMR solutions like Vigos, Fibrognostics, as well as Health Now. These are online platforms where you could book healthcare services that are available for cancer patients, especially during this pandemic. And finally, on the last pillar is the specialty centers, where the Ayala Cancer Hospital or program would fall under. Next slide, please. Yeah, so ultimately the group's vision is really to build an integrated healthcare ecosystem, providing more accessible, affordable, and quality healthcare to a broad base of Filipinos. The goal really is by the year 2030, 10 years time, 1 out of 5 or 20% of Filipinos would be accessing healthcare services through the AC Health network. Next slide, please. Specific on our topic, right? Today is cancer. AC Health announced a year ago its vision and aim to build the first dedicated private cancer hospital in the country that will cater again to a broader base of Filipinos. So even before the pandemic hit, the need for a specialized cancer center in the country is already evident and needed, and that has also driven the enactment of the NICA, right, that we were talking about earlier. For this project, we're working with an international group as well, who are cancer specialists operating cancer facilities overseas. And the vision here is to provide a world-class facility, that will have a complete range of treatment modalities for cancer, including chemotherapy, radiation therapy, surgery, and diagnostics. And number 2, aside from the facilities, we want to work, of course, with the top oncologists in the country. Doctors like Dr. Bill, others, who share this aim and vision, right, to change the cancer treatment and journey of the patient in the country. But number 3, the challenge for us is to be able to deliver these best practices, but still be affordable, right, to many Filipinos. Again, we talked about the challenge of funding affordability in the country, and we're building and designing every part of this program focused on being able to deliver affordable cancer treatment and care to patients. Next slide, please. Yeah, so the hospital will open in 2 to 3 years' time. But meanwhile, we're also looking to build a network of outpatient cancer clinics. And this one is provided for in NICA, right? Where, these clinics will be located initially in Metro Manila. We were looking at 5 strategic sites that will provide outpatient cancer care services where you would be able to access diagnostic, medical and chemotherapy services. That makes it easier and accessible for patients to get cancer care instead of navigating their way in the existing infrastructure for cancer. Then afterwards, we, together with the hospital, when it opens doors in 2023, this network will establish a hub and spoke model, where referrals and patients can access care in multiple sites across Metro Manila initially. Next slide, please. Now the pandemic hit us, from out of nowhere, apparently, and earlier this year. Next slide, please. We all got into a lockdown, and the plan to build actually the first cancer clinic was accelerated, by the pandemic. Instead of slowing us down, we actually accelerated it. Of course, part of AC Health, we've responded and have kept, the family doc and healthway clinics open throughout the pandemic, and even provided additional services for screening COVID-19. But with a lot of the country's resources in healthcare focused on trying to control COVID, we simply cannot forget the plight of cancer patients. So that's why one of the clinics of Healthway, the one in Greenbelt 5 in Makati, we actually converted and repurposed into a chemotherapy infusion station that can be an alternative safe site, for patients who want to continue treatment during the pandemic in an alternative site outside of hospitals. Next slide, please. So this is one example, that the group has embarked on. We were given DOH has given approval to Healthway Greenbelt 5 to open outpatient chemotherapy infusion cancer services. And it was given to us last April and will run until end of the year. And so now we could actually continue treating patients who potentially have been displaced because of the pandemic in a site outside of hospitals, again, safer, where we have put in place protocols to ensure that the patients are safe, right, and protected from COVID-19. And then we also hired a specialist team, right, to be able to support the treatment and oversee the care of the patients. We have 2 certified medical oncologists, members of the PSMO as well, and a team of experienced oncology nurses, right, who are overseeing the treatment of the cancer patients at Healthway on an outpatient basis. Next slide, please. Yeah, so really that's what we wanted to share, right? That these solutions, have to be brought out, right, solely for the purpose of improving the patient journey in cancer. And all the groups, have to work together and collaborate. We look forward to collaborating with the different stakeholders, getting feedback from the PSMO, the patients, working with the government to try to move forward quickly, right, and address, the challenges like funding, solutions. Even though we have a pandemic that we're dealing with, we simply cannot forget the importance of cancer and the other, illnesses that continue to affect our country. And I think this forum is a big opportunity for all of us to come together and work together and achieve, a better place, for cancer patients moving forward into our future. Thank you.
Thank you so much for that, Ivan. And thank you, AC Health, for everything you do for our cancer patients. And I think I speak for many of our viewers right now that we are eagerly awaiting that cancer hospital. And also, thank you so much, Dr. Bill, for all your efforts in pushing the NICA forward. And I hope you get all the signatures you need and more. Okay. So as we go through the next stage of our session, thank you again to both our speakers. I think what's really important is to always remember that the Cancer Game Plan 2.0 would only be effective if we involve the public and private sectors. After all, this initiative is a collective effort. Again, thank you, our panelists. We can now move forward to another discussion on empowering the cancer patient's journey. Thank you to our previous panelists, and now we're moving on to the third segment of our session. We are very, very lucky to have with us the voices of hope, the Hope from Within ambassadors to share with us light amid these trying times. And let's welcome to the panel is Tirsa Cruz III, lung cancer survivor and Hope from Within's lung campaign ambassador advocating for early detection. Ariela Arida, the newest Hope from Within ambassador, lung campaign ambassador. Marlo Mortel, a caregiver to his mom who died of breast cancer and is an ambassador for Hope from Within's hashtag BC We Can campaign. And Nina Corpus, the Cancer Game Plan PH ambassador and Hope from Within's Tita Hope. Again, please, our panelists, thank you for joining us and please say hello to our viewers.
Hello, good afternoon. Good afternoon nga ba? Yeah.
Hello, everyone.
Okay. Thank you so much. And as Voices of Hope, I believe you guys have a message to share with our audiences today. And so may we please start with Mr. Tirso Cruz III.
Hi everyone who's there. When you think about it, parang scary yung title ko, Lung Cancer Survivor. But that's the truth. And of course, first and foremost, to my former smoking buddies, I would like to remind you, get rid of that habit really. I mean, it's not going to do you any good. Many years ago, I used to smoke, and I never thought I'd get this sickness. I think most smokers think that way until suddenly you find out about it. As I was introduced by Shat, I am advocating for early detection because by a very I got my early detection through my son. It was a suggestion from my son. I mean, I missed out for 2 years on having our executive checkup. I used to have executive checkups with me and my wife, and I think time came, time ate up, work ate up most of my time, and I passed I passed 2 years without having my checkup, and then my son suggested that we do have a checkup. I mean, I'm not going to mention the name or the family anymore, but a very, very close friend of mine whose son had the same thing about with cancer, and we heard about it, and it really affected us. I mean, because when you're with friends and you worry about parents and you worry about their children, and so when my son suggested that I get myself just the regular checkup, I did, and that's when I found out that they found a lump, the lower right part of my lung, and by the grace of God and through the good doctors that I have, to cut the story short, I was diagnosed with the disease itself, and the doctors told me we have a good fighting chance because the disease was found out right away, the lump in my lung, and so a friend doctor of mine suggested, let's not waste time, let's operate and take it out, and then you go through the motions, the treatments, and I guess I can say that I'm a living proof that early detection really does a lot of help. Doesn't really mean that I'm not gonna get it. I'm not scaring you. and it could happen. And so after that, the next best thing to do is be careful. Always watch out for yourself. Take the precautionary steps like eating right, avoiding like I said, avoiding smoking and other other foods that can basically put you at risk of having the disease.
Mhm.
I guess
Thank,
that's it for now.
thank you. Thank you so much, sir, and we're so happy to have you with us. And
I'm
I
glad
think
to
I
be here.
yes, and I think the most important part of your talk is that how important early detection is in increasing survival rates for patients with
Yes.
lung cancer. And now we're going to Marlo. Please share with us the importance of having a strong caregiver in the fight against cancer.
Well, kasi we all know that they're already battling their own battle, which is the cancer itself. So, kailangan meron ka talagang matinding backup. And that is your strong set of counsel, and that is your family, friends, and mental health is very important. Kaya, minsan napanghinaan kasi sila ng loob. Every time I go home, my mom puts a smile on her face, pero deep inside, she's actually yung hopes niya nawawala na. Kaya there was this time where I wrote a song, it's called I Pray, para ma-strengthen palalo yung faith niya, na huwag siyang bibitiw. Kasi although yung body natin nag-deteriorate, yung faith kasi ng mom ko is matindi. Hindi yung paniniwala niya kay God, and na it's God's will. Kung ano man yung mangyari is mangyayari na. But kami mga nakapaligid sa kanya, of course, we don't want her to go yet. We want her to stay with us. Kaya as much as we can, even though we want to cry, even though we want to give up, we strive harder to help her. We make her laugh, we make her happy, and I worked harder because I'm the breadwinner of the family, so I try to work double the effort para sa kanya, para ma-sustain lahat. And hindi naman tayo mauubusan ng ways to give up. So tayo mga paligid sa kanila, sa mga nagdumalaban sa cancer, the best that we can do is just be there for them every day, because we don't know what they're thinking of. We don't know kung ano na yung mga plans nila para sa future. Kasi tulad ng mami ko, we bought this house, and we bought this for her. Pero unfortunately, wala na siya nung pagpunta namin dito. Nag-open heart surgery na siya, so hindi na niya na-enjoy. So nawala na yung mga plano niya for us, kasi all she wanted was to have our own house. And ako talaga yun yung pinag-ipunan ko for her to have it. So, minsan, yung drive natin naka-base sa kanila. So sila pagka na-out of focus na din, tayo din na-out of focus, pero kailangan natin mas maging stronger kasi tayo yung nag-a-assist. Daddy ko yung nagbabantay sa kanya dito, nag-a-assist ng mga dapat gawin sa PCSO, salitan kami. Hindi dapat tayo ma-down. Tayo yung number one na dapat comfort nila, and of course, ang kanilang shield and strength. So just keep on going.
Yes. Thank you, Marlo, and thank you for your support to your mother. And I think it's been said earlier na hindi lang ang patient ang survivor when it comes to cancer. The family, the friends, the support groups, everyone's a survivor. And so we go to Miss Nina, and who'll talk to us about long-term solutions for cancer.
Yes, Charlene, we've had many conversations already on cancer in the Philippines. And as a journalist myself, I've seen it. I've attended them in person too, seminar after seminar. And this time, webinar after webinar. Hanggang sa naging Tita Hope na ako. So bata pa ako, pinag-uusapan na to. Okay, and we've seen many steps forward too. Like, we're all here right now. So, this is a good place to be. But implementing these landmark laws in full, the Universal Healthcare Law, and the National Integrated Cancer Control Act will be monumental. And finally, yung mga kababayan natin, they will feel the effects of all these forums that we've been holding for cancer for many years. So para po ito sa mga pasyente. The UHC and the NICA are for our cancer patient kababayans and their loved ones who yearn for a new lease on life, for a win against a disease that's no longer considered a death sentence. And now it's been proven in numbers in the Cancer Game Plan report that more people who have access to innovative treatment options like immunotherapy can help people see better survival and better quality of life. So, what we need now is a game plan for long term sustainable access to these innovative treatment options that can potentially add years to life and life to years of patients suffering from lung, breast, and other types of cancer, and to help inform the public to have this healthcare policy discussion surrounding the health impact. The action behind this plan, it's a petition to urge government decision makers to fund innovative treatment options by way of the UHC and the NICA. I'm hoping that everyone watching right now, whether you're a cancer patient or you know someone battling cancer or just care about the healthcare of every Filipino in our country, will consider taking action on this plan. This will help enable more equitable cancer care for more Filipinos and give them chances at living life anew. As we've discussed earlier with Dr. Bill, you may not know someone right now, but tomorrow, di mo alam, next week, next month, it may be you or your loved one. And then this issue, di ba, will become more personal to us as we've listened to the other panelists here right now, di ba? So we all have to move so that this campaign will continue, and that right now maybe you can say that you have nothing to lose and everything to gain in case it happens to you, because right now this is our problem. Charlene.
Yes, thank you, Nina. Yes, this is our problem, and we should really work for long-term sustainable solutions for it. And last but not the least, Ms. Ariela Arida, who is going to talk about the Community for Cancer journey.
Pauline, and hi to my co-authors, Miss Nina Marla and Mr. Tirso Cruz III. Actually, when I was listening to the story of Mr. Tirso Cruz, it reminded me so much of my dad, like, because he had lung cancer, and he started also as a smoker. But then I would say the only difference is Mr. Tirso Cruz had an early detection, and my dad had a late detection of his cancer. That's why when I really signed on to become one of the voices of hope, all I could pick up about was this community was really an incredible one. And it's amazing to know that you have someone, that you can sort of, even virtually, would be there for you and would guide you throughout your journey, especially taking care of your loved ones. And how I wish that I had this when my father was battling cancer. And so I know that this understanding of a cancer patient journey, the steps that we take to go from diagnosis to treatment to survival, and even the people that we talk to get better, and the places that we can approach to get financial help for the treatment, and even the community, so that we can find inspiration from all these steps are all important, not just to the patient, of course, but to everyone's life who has been touched by cancer. So I would say, like what Marlo had said, na talagang ang laking bagay na meron tayong kakampi at kasama sa journey na to, because no one should fight this cancer alone. And for all the caregivers na kagaya ko, dapat tayo mismo, we should be the one who first understand them. Tayo na yung lumapit sa mga mahal natin sa buhay. And I know, especially in this challenging time, na talagang it's really important na maramdaman nila na andito tayo sa tabi nila no matter what happened. And we should be the one also to offer our care, help, and assistance sa kanila kahit sa anong bagay, na kahit sa screening pa lang, dapat we should be the one giving them support and encouraging them. Because, based on my experience talaga, as early as possible talaga when you seen signs or symptoms, don't be afraid and don't hesitate to ask. That's why I think this community has been really helpful because they're really there, really open to be asked and to really guide everyone who is in this journey. And yeah, that's why um, I'm really honored and very happy that I found this community because I know that they will be here for us and to anyone who has been in this journey, because I know and I believe that in this battle we should not be alone at may katulong tayo sa buhay natin. And that is why actually I'm very also happy to announce that Hope from Within has also a Hope for Lung Cancer Facebook group wherein all the patients, survivors, caregivers, and even medical professionals and advocates can come together and talk. I guess this is what we needed. Like, we should just share all our stories for them to be able to be stronger and to find inspiration from our stories. And don't be hesitant to talk about everything about this journey, because I think ayun yung nagiging problema when we were very hesitant when we see symptoms or we find them. So I think it's really important that we are here for them, that we show support to them, and we encourage them that we won't leave them no matter what. And that is why I really wish that I had this community when my father was still with us. So yes, to everyone who's watching now and who's fighting a cancer battle in one way or another, we are with you. And because I believe that no one should take this journey alone, feel free to share and to talk about all your stories in your battle and in this journey, and we will always be with you.
Yes. Thank you so much, Ariela, and thank you for all your stories, sharing with us your journeys. And it's right, nobody has to face this cancer alone. And now moving forward, I'd like to go to Marlo, who's been the caregiver of his mother. Marlo, we've discussed several times that it's important to have a really strong support. But what are some ways ordinary Filipinos and their families can push for access to quality healthcare and innovative treatment options?
Well, as Ariella said earlier, we need to know the cancer patient journey. We really need to be knowledgeable kasi tulad namin, madami kami mga maling move na nagawa because my mom doesn't want to have extra help from our relatives. So kami lang na daddy dito yung naghahanap dito. Tatanong dito sa doktor na to, tapos pupunta naman dito, and unfortunately, it resulted na may mga maling nagawa. So you really need to know all the right information for the patient, and of course for the caregivers as well, kami, kasi we can't do it alone and we really need to ask better questions. Isa sa mga natutunan ko is instead of like asking, bakit kaya ganito yung nangyari? Bakit kaya ganyan? Let's ask better questions. What should we do to move forward? What should we do for this cancer journey to have an expected win in the end, kahit naman hindi naman natin talagang masasabi, kasi minsan kahit gaano katinding laban natin, fight a good fight, faith, hindi pa din ganun yung resulta na nangyayari, diba? It's different for everybody, but as much as we can, while we're still with the patients, let's fight their fight, diba? And knowing how the battle is winning, half the fight. And as Miss Nina said, sign the PSMO petition. One signature can do a lot of good for so many Filipino people. Tayo din ang magtutulungan dito. And like Ariella said din, I really wish na sana na-meet ko na kayo before itong Hope From Within Foundation para mas informed kami like about detection, on how to do it. Like yung mom ko ay na-isolate kasi niya yung sarili niya. Instead of isolating herself, sana, alam mo yun, na-live pa niya yung life niya beautifully with the people she loves, and also hearing stories from other people and gathering strength from those people din, di ba? And tayo din mga caregivers, sana ganun din. Ako actually, ito yung dumadaan na po sa kanina. This is blue. Nangiistorbo siya, pero I bought this cat a week after my mom died. Para kahit para medyo masigla pa din kami dito. Kasi it's so lonely. It's only me and my dad. I don't have any brother, sister. It's only me working dito. Kaya ang sad lang. Lalo tong bahay nga na nabanggit ko kanina. Ang sad lang na wala ng mommy ko na nakaupo dun sa second floor. But again, that's just life. So sana wag mangyari sa mga nanonood dito. Sana hanggat kaya natin, ilaban natin po ang mga journey nila, and of course, yung fight nila for cancer by being informed and by doing the right moves.
Yes. Thank you so much, Marlo. And yes, we need to inform more people so we can have better success stories when it comes to the cancer journey. Now we go ahead to Mr. Tirso Cruz III. So, Mr. Tirso, how, apart from easily accessing treatments and medication, how else can we show our support for cancer patients during this very difficult time? Sir, nakamute ka po ata. Sir? Sir, you're on mute. Sorry, sir. Mr. Tirso, you're on mute.
Yeah, I'm sorry about that. Gaya nga na sabi ni Marlo, I mean, like, we should talk to them and we should ask the right questions and don't fear going to the hospital. I, for one, I mean, I'm saying that right now because I have benefited from the fact of going to the hospital, getting a simple checkup, and the benefits are overwhelming. Talagang napakalaki. It's a win-win situation for anybody. Don't be afraid of going to the hospital. And I will tell you, whether you're feeling something or not, I mean, go and have your checkup. Kasi kung may nararamdaman man kayo, it's not going to go away by not going to the hospital, by hiding from it. You have to accept the fact that if ever you're diagnosed and you have the disease, what's important is how do you go about it? I mean, what's the next step? What should you do about it? I mean, trust your doctors because these people, I mean, doctors spent years of studying of how to help patients and people who get sick, especially with this disease, cancer nga. And gaya ng sabi ni Ninya kanina, nung araw kasi pag sinabing cancer ka, parang death sentence eh. Diba? I think that's why a lot of people are afraid and that's why a lot of people are scared. But as the sickness has grown, marami na pong nagkaroon yan. Yung knowledge and the medicine also has progressed. Marami na ngayong mga bagong gamot that has really been proven to help. And yung number one talaga, because ako living testimony ako, go and get your checkup while it's still early. Because sasabihin sa'yo, kahit ang doctor sasabihin sa'yo, the earlier we find out, the bigger the chance of survival and the bigger the chance of beating this disease. It can be beaten, but pwede siyang talunin. It's all up to you. It's up to your caretakers. It's up to the people who are around you, the people who will show you love, and the people who will take you by the hand and join you. Yung nga sabi nga kanina. I mean, you need people who will journey with you. And most important, pinaka-importante po sa lahat, I am not trying to be preachy or anything, but most important is calling upon the Lord.
Yes.
I mean, I cannot equate and I cannot tell you how much help prayers has been for me. The prayers of my family, the prayers of my wife, my children, prayers of close friends who really, the expression guys, they stormed the gates of heaven, praying for my salvation and praying for my healing. And through the help of these good doctors that we now have, truly, it has been done. And ako regularly, up to now, I'm telling you, every year, I have my PET CT scan for maintenance lang. When I got my cancer, it used to be every 3 months. After the operation, after my treatment, I did not have chemotherapy. one of the new techniques was given to me. They call it adjuvant treatment. It's more a preventive treatment of sort of chemotherapy than the cure for it. And first, naging 3 months yung aking PET scan, and then after a while, after so many months, naging every 6. And then after that, last year lang, nag-decide yung doctor to sabi niya, I think you're over the hump already. We'll have your PET CT scan every year na lang. But, yung nga, reminder niya, anytime you feel something weird or anything, come to me right away. As soon as you feel something or anything for that matter, or have your still, I mean, even if you have been, I would like to claim that I cured and that the Lord has healed me. But the doctor advises na you still go and have your checkups and you still observe the proper protocols for, trying to keep this disease away from your body. And not only your body, but even for your family and your friends.
Yes. Thank you so much for that, Mr. Tirso. And now, Ariela, as a Hope from Within ambassador, one of the newest ones, how can you be a voice of hope in guiding patients and caregivers navigate their patient journey?
Yes, Charlene, we all know that it's really all been said, but I think it bears repeating that everyone is a voice of hope. So we should not be afraid to tell our story and we should not be afraid to listen also. And I really wish I have known Mr. Tirso Cruz story earlier because I really like it reminded me so much of the journey I have been through. The thing nga lang talaga, I should have like known like this community and ask people and know their stories because it really make a big impact and difference. And so I think what we need to be emphasized here now to our viewers, patients, caregivers, and everyone in this journey is that you really don't have to do this alone. And I have been given opportunity and privilege also to spread the information and knowledge that I myself wasn't really able to fully take advantage of. And so now I know that many Filipino cancer patients have all this advantage of knowledge and time, and I hope that they can use this advantage because early detection can really make a difference in a patient's survival. And we all know that. Ang daming stories na really it's early detection that really save lives and make everyone and or make a big difference. And that's why I hope to all our viewers who are listening now or watching us is that let's take advantage of the information about the cancer patient journey because it really saved a patient life.
Okay, thank you so much, Ariela. And now for Miss Nina, I think you've said this before that cancer is not anymore a death sentence, but can you please elaborate on why is it so?
Yes, just look at Sir Tirso, no? Judge Arturo. He still looks the same. So guwapo pa rin, di ba? I mean, it's no longer a death sentence talaga. And so many innovations have come to light in the recent years, and cancer isn't the same disease as it was before. Now people have less to fear. Like the Cancer Game Plan report states, the numbers have proven that innovative treatment options can really make a difference in terms of patient survival. Cancer can now be treated successfully. All that's needed is that people face their fear, get screened early, because early detection is key. We cannot overemphasize that. That's the most important, no? And of course, they need access to innovative treatment options. But we cannot do it alone. Ariela has been saying that it can't all be up also to the patients lang and their loved ones. Sana this should be a concerted effort for everyone to move because in the end, it can affect all of us. This can be achieved when everyone from the individual, the private companies, and the public, the government, step up for our cancer patients. And for us, no, kanina, let me just repeat again, Dr. Bill stated, yung PSMO petition, 6,000 signatures na lang po ang kailangan. No? We need 25,000 signatures. So each signature is very significant. And that's why also we're all here doing this. We continue to talk, to engage, make people aware, because really we know there is hope.
Yes. I think it's important to just keep talking and talking about this so more people can be informed. And thank you so much, everyone. Thank you, Nina. Thank you, Mr. Tirso Cruz III, Marlo Mortel, Arielda Arida. Thank you so much, everyone, for sharing your stories of hope with all of us. And just to cap up our today's discussion, what we learned is that we must all work together towards building a future where all cancer patients can enjoy more hopeful tomorrows. Big or small, we all have a role to play. Again, PSMO is leading a petition campaign to approve the DOH fund for Danica. You may support the cancer patients by signing the petition. Simply click the link in the comment section below. And to access more information on how to navigate the cancer journey, you can join the Hope for Lung Cancer Facebook group. This is a digital community where lung cancer patients, survivors, caregivers, advocates, and doctors can share their experiences and pain points in their respective cancer journey. Everyone is invited to join, and we're now flashing the link to the website and the Hope for Lung Cancer Facebook page. The link will also be in the comments section below. And now we're seeing the petition, the page for the petition for the NICA and the council. So, all right, thank you once again, everyone. Thank you to our speakers today. Thank you for everyone who's watching from home. We all hope you're keeping safe. And many, many thanks to our partners, Hope from Within, Learn, and of course, again to everyone who joined today's discussion. Be sure to tune into Business World's social media pages to be updated on our next projects. Again, this is Charlene Chua, and this has been Business World Insights. Stay informed, stay safe, and stay healthy. Good day, everyone. Thank you so much.